respiratory therapy, pharmacy to the ER room 55, respiratory therapy, pharmacy to the ER room 55 staff, respiratory therapy, pharmacy to
Code
the
blue,
ER room 5
ICU.
staff.
Code blue, ICU. Code blue,
This is the trauma bay.
ICU. I thought we were going to your office.
In office.
Trauma.
Welcome to Trauma Y and Crash. I'm Y,
I'm Crash.
and welcome to our podcast and YouTube. What is our podcast and YouTube about? All things Browns. We're the nurses of the dog pound. First off and foremost, but lots of education. We're going to talk about a lot of nursing stuff. We're going to talk about medical.
COVID.
We definitely talk about COVID. You know, we're going to get into the nitty gritty about that. Disasters, disaster preparedness, first aid kits, how to be prepared. A lot of interesting, good topics. So we hope you enjoy today's show. Welcome. Today, we need to talk to the healthcare community and the world in general, but especially to the healthcare community. There are so many nurses, medics, and respiratory therapists that have COVID that I know right now.
Yeah.
I mean, I've had friends who've been very sick and people that I know have gotten very sick, but the numbers have not been like they are now. The numbers are staggering. And we want to say, one, to the public, I hope you all are seeing this and understanding what's going on. The other is, to our fellow nurses and other healthcare workers out there, we are praying for you. We understand, and we are just hoping to help get through this without losing anybody else.
Yeah, it's very difficult. Every time you go to work, you're wondering whether or not you're going to be able to go home, or you're going to get sick, and if you're going to get somebody else sick in your family, but you still come in and do your job like you're supposed to. It's very stressful.
Yeah. And we had a little break because somebody got quarantined. But, I've been lucky. I've been very, very lucky because I had it in the very, very beginning. I had it before they really even started testing. And my symptoms, I probably should have went to the hospital, but I didn't.
Nurse.
But it was some shortness of breath, lots of fatigue, exhaustion, and I couldn't stop my fever. I had a constant fever. And, we were hearing about it, but there wasn't any truly confirmed cases. Like, I think the first confirmed case came out right before that, but I was sick in the beginning of February. And my wife never seen me that sick. I was in bed. I didn't do anything. And I told her I was okay. I just need to rest. Give me some fluids. I'll be fine. I constantly had a temp. Could not get rid of my temp. So I probably took 3 pounds of Motrin and Tylenol because I'm an ER nurse. So we hammer.
Yeah.
So every 2 hours I was taking Tylenol or Motrin,
Yep.
alternating it and making sure I woke up just to do that. And the other thing about it was, for almost 3 months afterwards, I had to use an inhaler.
Yeah. It's just not just having COVID. It's the side effects of it, too. It lasts longer than the signs and symptoms that you have, say, if you're in a hospital and you get sent home.
Yeah. And so I talked to my doctor and told him what was going on, pretty much after the fact. That's kind of what I do. I'm probably, and for those who don't know me, I'm an ER nurse. I try to take care of it. Now, I believe in taking care of myself. I'm not going to ignore something and end up worse because I can't go down. I got stuff to do. But I diagnosed myself with diabetes working, and literally, well, we won't really get into that, but I diagnosed myself and took care of it through the weekend because we had insulin at home. So I used that till that Monday. I could go to the doctor. I went to my family doctor and said, hey, I got diabetes. Here's what my sugar's been. Here's what I've been taking. Can you put me on some meds? And he was he's my doctor, so he knew me. He was like, sure, we'll get you together. What meds, you have any idea what you want to be on? And we worked together like that. But this COVID is just, there's so many people. Every time I look on Facebook or Instagram, I find out that another one of my colleagues is sick.
Yeah, we've got over 50 people out at the facility that where I work at, and I think half of those are positive, and the other half are just waiting to find out the results. And it's, I had earlier thought that I had COVID, not sure, because my daughter was very, very sick. And I was told by my physician, as a lot of nurses, if you're not exhibiting signs and symptoms of being positive, you still should go to work because you're a, what is the term they use for people that have to go to work?
Essential?
Yeah, you're an essential worker. Not that, you won't get worse or you might not, get sicker and die. It's just you are an essential worker, so you need to go to work. And I think that's kind of demeaning to me, but that's the way it is what it is.
That's just wrong. I mean, whoever would say something like that, that's just wrong. Why would you want somebody sick to go take care of other people who's infectious? That's my biggest thing is why am I don't want you around anybody. You positive? And and that's what's going on. Is it North Dakota?
It might be. They told them if they were sick but not having symptoms, just come on to work.
And I understand they're saying they're short-staffed, and that's when you put out a plea to get help and get some agency nurses in there to kind of help, because you're only going to spread it more unless you put those are the nurses who take care of the COVID patients.
All right.
But even then, you're wearing them out, and we don't know the long-term effects. It's just really bad, and we just want to acknowledge all the healthcare workers and all the other essential workers out there who are putting themselves at risk to help everybody else.
Yep.
And I just want to implore you to please make sure you're wearing your PPE, wear your mask. Check your equipment. Make sure your equipment's in working order, that you don't have any cracks in it or anything like that, because it's getting us. These numbers are staggering. In one of the daily reports for the state, they talked about 300 healthcare workers with positive COVID up in Cleveland for one system.
And that's a big hospital.
300. Even and it's a system, it's multiple hospitals, but 300. How are you going to take care of people like that? And everybody's getting worn out, which is one of the reasons why I think in the beginning, not as many of us were getting it, because we kind of build up our immunity. But people are getting beat down and we're doing it for so long.
Yes.
They're more susceptible.
I was reading one article that said that more than 1,700 healthcare workers have died from COVID. That's including 200 nurses. 200 nurses that, just doing their job. Never in our job description does it say that you have to risk your life. Not saying that we wouldn't, but it never stated that as a nurse you'd have to risk your life and the life of your family doing your job. So, we still come and do our job even though we endanger ourselves and our families. We do what needs to be done because we are nurses.
Yeah, and sometimes people take advantage of that. With the workplace violence, because I know there are some people who believe that comes with the job. But, my answer to that, my retort is always, is it in a job description? Because if you're supposed to deal with it, then it would be in your job description. And I've yet to see a job description for nurses or healthcare workers that says patients are allowed to spit in your face or kick you or punch you.
Mm-hmm.
You know, but that's another topic. Let's, go back to this COVID. I'm sick. I saw a message from a nurse. Becky she mentored me. She was one of the nurses when I first became a nurse. And, she's in the unit struggling. But, I'm praying for her. Hope she pulls through. One of my old units, a good portion of the staff has been exposed or sick. And as far as I can tell, most of them are not hospitalized, but they're all feeling bad. And some of them have pre-existing conditions that really put them at risk. And it's bad. And we just want to say that, we appreciate all of our colleagues and all the other the essential workers who are out there doing this day in and day out.
And hopefully the public, I mean, if just look at it this way: if you want to save a nurse's life, wear a mask. You'll save a life if you just wear a mask. Look at it that way. You can save us from being sick, so we can take care of you if you just put on a mask.
But some people don't. There are people in healthcare who don't believe all the hype, and I'm not saying it's as bad as everybody wants to say it is. I'm not saying it's not. But you got to look at what's real. We're taking care of all these patients. People are doubting the numbers. You got sick patients, and everybody's getting overwhelmed. When New York was overwhelmed and all these patients were sick, you can't ignore that. And now it's all over the country, and the numbers are higher, and people are getting beat down. It's just. Like I said, I really pray for all the healthcare workers out there. I wish nothing but good thoughts. I don't like people being exposed and putting their life on the line and getting sick like this.
Yeah,
it's going to be interesting how healthcare recovers from this, because even the people who get through all this and aren't sick pay a price. How are we going to do mental wise? What's our field going to look like in 5 years? How many people after dealing with this are going to get out early?
Oh yeah, they're talking about nurses now and doctors that are just like, we're done. I can't do this anymore because I've done it so long. I'm done. And people that wouldn't retire for 5 years are going, I have to do this now. And it's you think it's a shortage now, just wait till after all this is done, and people go back and look and say, I can't do this anymore, because some of the hospitals are very good with their staff, and others you just feel like you're holding a space. And if you fall, then they just put the next person in place, and that's not right. And you get tired of it. So hopefully we get more nurses in, but I don't know what's going to happen in the next 10 years.
Yeah, and the other thing I would say to all the healthcare workers out there and everyone else, talk to someone. Go get help. EAP is a wonderful thing. I have recommended so many people to EAP, and they have always done a wonderful job. But you can't take this burden on alone, because a lot of this is stuff that you deal with, and when you come home, you don't talk to your loved ones about it. You don't tell your kids, your spouse, your boyfriend, girlfriend.
No. And my wife asked me that, how come you didn't come home and talk about what your job? And she always says, when I come, if Wyman calls me, you talk more to him than you do to me. Well, hey, it's some things you just don't want to discuss with other people, and you wouldn't feel comfortable. And nurses are nurses. We can say just about anything to each other. So, yeah, spouses don't quite understand unless they're in the medical field.
Right, and sometimes people don't understand how you could have that conversation and not fall apart, because you can't. But you gotta have a sounding board and somebody to talk to. you know, and that's where it makes a difference. I was blessed to work with the chaplain services that I worked with through my career have always been wonderful. You know, they knew when staff was coming, because sometimes they come to me and say, hey, you know, you need to look out for so and so because they were struggling a little bit. I'll talk to them and stuff like that, and it's great. And you know, I'm an ER nurse mainly, but you know, we have a camaraderie that you don't really see in the other units as much because we're more of a team.
I wouldn't say that. The ICU is a team.
They're team-ish.
No, we're a team.
You know, now outside they have relationships that you relate outside and things like that, but I don't. I still feel it's a little different.
I don't know. I mean, because even the ED, you have people that you're close with, and some that you don't. You have people that, and I don't hate to use the word click, but there are some people that get along with other people, and they're tight. If you fall, I got you. If you walk by and see somebody trying to turn somebody, they can't do it. Hey, hold on, let me help you. You know, we're like that. I know there's some nurses that some don't do what they're supposed to, and you like, if you help me, I help you, but you don't ever want to help me, so. It may not be right, but you know that's the way it is.
Yeah.
But for the most part, we help each other.
And one thing I have to say is I feel like, you know, I've been blessed because I've worked in areas where you can't tell. I mean, there's people who are working together that can't stand each other.
Oh yeah.
If you see them out on the street together, they fighting, or one of them hitting the other one with their car or something. But you know, inside those walls, when it's time to take care of these patients, everybody does what they need to do.
Do your job.
You know, but again, all that stuff takes a toll. And really, that's all we really want to say is we recognize it, and we hope that you're recognizing it and seeking whatever help you need. But please, please be safe.
Yes.
Because, go ahead.
Oh, I was going to say, as I tell my children, it's better, I would rather you respect me than like me. You don't have to like me, but respect me enough that if you need something or something going down, you can say, well, I want him here because I know he'll do his job. You can dislike me, but respect me, and I'll respect you. What?
I don't think anybody dislikes me.
Okay, anyway.
Why you look like that? You look like...
Anyway.
Wait a minute, are you trying to tell me something?
No, you just need to go back and maybe talk to some of your... I'm just saying, you know...
I'm only joking before somebody goes. I'm only joking. But yeah, I understand that. And you're right. Because sometimes, you know what? I want to piss you off. If I'm fighting for you, and sometimes if being mad at me helps you do what you need to do, somebody like the smokers, if they go to buy a pack of cigarettes and they think about, well, I don't want to hear wine in his mouth. If I get short of breath and come in there ER, he gonna have to hit me. He gonna be getting on me and stuff like that. I won't buy this pack of cigarettes. I won. I helped him.
Yeah, that don't mean they like you.
No, but the other thing that does is people like that who I'm on to help them take care of themselves come to me if they sick. They know that if they need me, I'm gonna take care of them.
Yeah.
You know, but you know, this is one of those we was like, we got to get together and talk about this because it's just so bad. I was looking at the numbers, and like I said, I was looking at Facebook, and then I really just started trying to count how many people I know that are under quarantine or positive COVID just right now, and the numbers are staggering. And I'm talking nurses from California, Texas, Florida, Indiana, New York. People are positive. So it's not like I'm talking about like just in my area, but in my area as well. So, well, that's it. We just wanted to say, like we said, please be safe out there. And if you need help, when you need help, please ask. You know, reach out to your mentors, reach out to EAP, reach out to your pastor, reach out to us. I mean, we're always available on on our podcast and YouTube. You send us questions and stuff like that. We'll get back to you. Do you have anything else to add?
No, just take care of yourself and
Hoard your PPE. Number one rule is take care of yourself first, because you can't help nobody if you laying on the ground next to them.
yeah. And flu season hasn't even gotten here yet.
Yes. So, all right.
Be
You
safe.
all take it easy.